I'm Sian. I'm one of the lecturers from Anglia, Ruskin University. Can you all hear me fine? I don't know what you are actually all thinking about this. I don't know, are you actually thinking that I've heard about my progress and actually it's something I'd like to do, but how on earth are we actually going to get money, financing? Do you all kind of feel like that? I don't know whether you've got interest in things. I just want to take you back to when I was first, quite close to the beginning of my career, to try and give you some inspiration of anything is possible if you actually believe and actually go for it in a persistence. I was a senior staff nurse down in Bristol. I don't know if any of you have ever worked in Bristol, at Southmead Hospital. And for 7 years, I've been wanting to get a sister's post, and I was struggling to get a sister's post. And there's an acting post came up because somebody was going on maternity leave. And I thought, you know what, I'll take that acting post. And I've taken a few acting posts during my career, which have proved incredibly beneficial to me. I thought, I'll take that post. And the person who was going on maternity leave said, Sian, what we need you to do is we want to put an overhead tracking hoist system in the intensive care unit. She said, I've been trying to do this for a couple of years. Can you make sure that you get that done while I'm on maternity leave for 6 months? By the way, we haven't got any money, and you need to close down the intensive care unit for at least a couple of days while you actually get the tracking hoist in the intensive care unit. And I thought, do you know what? I'm just a staff nurse. I can't actually do that. How do I actually do that? I've got no money. I've never had a senior post before. I don't really have influence, power, authority to get this done. But I wanted that sister's post, and so I was determined that this was going to happen while I was acting up. Because then I thought, if I get this done, then I stand a better chance of actually getting that post when a full post comes up. So I thought, where am I going to get the money from? No, well, actually, I got some quotes, and it was going to cost £20,000 to do the whole intensive care unit. I thought, I can't raise £20,000, but maybe I can do 1 bed space. Maybe I can get a hoist over 1 bed space. So £1,200, £1,200 to get a hoist over 1 bed space. The benefits of this were that we could use it to sit the patient up. I don't know if any of you've ever been into an intensive care unit. When you're trying to get hoists under beds, all that equipment all around it, real nightmare. So I wrote a letter to the friends of the hospital, and I thought, you know, I need to speak the language that they actually talk. I need to get what is it the issue for them. And the friends were very much focused on patients. So I wrote my letter about the benefits that this hoist would have for the patients. And I said how much 1 hoist would cost. And I said, well, we've got 18 beds. But I realised that you can't fund all of this, but if we could just start with 1 bed, that would be fantastic. And the friends rang me up and they said, this sounds fantastic. Would you like to do all the beds? We can give you the full £20,000, you can do all the beds. I thought, goodness me, that is absolutely phenomenal. And then I thought, now all I have to do is persuade the intensivist to close the intensive care unit for a couple of days, and the medical director. And actually, to do that, I need to persuade some surgeons to not do major surgery for a couple of days ahead of this. Can you imagine? Just ridiculous. Anyway, we did manage to cut, for 3 days prior to the closure, we didn't have any major surgery going on. We managed to requisition one of the recovery rooms from the operating theatres, where we moved the patients from intensive care for 2 days while the intensive care unit was closed, and we put the overhead tracking hoist in the intensive care unit, and all the patients benefited from that. And what that actually taught me is that actually you really have to want something, and you really have to believe that you can achieve it. And if you have a go, you don't know where you're actually going to get to. And actually, that's been very much in this project. It's not been easy. So as I'm talking you through it, I'll talk you through some of the trials and tribulations I've actually had as well, and how we're trying to organise it and how we've been trying to manage it, and kind of the barriers that I've come up against. Just a little bit about Anglia Ruskin to start with. I'm lying a bit because we're now split into 2 faculties, but up until September, The Faculty of Health had 10,000 students. I don't know how big your university is, but that's actually bigger than some small universities. Phenomenal amount of students. We're the largest provider of health, social care and education across the east of England. And as a university, we currently train nurses, midwives, operating departments, practitioners, paramedics and teachers right across the eastern region. Of that, we have 1,500 pre-registration student nurses, and our nursing courses are good. They are good. The NMC in 2013 actually came and said that we were outstanding for fitness to practice in what we did with practice with our student nurses. So we know what we're doing is good, but what we actually want to do is make it even better for our students. And we have problems. We have significant problems. I was talking to some people just before I came in, is we are a campus. Well, we're 3 campuses where we have our nursing students based. So we have the students, well, you're down in Chelmsford currently. So we have students, nurses based in Chelmsford. 50 miles north, we have student nurses based up in Cambridge. And 50 miles north of that, we have student nurses based up in Peterborough. And we have student nurses in placement all around this region. So the whole, a large bit of Essex, and the eastern region, we have student nurses placed in hospitals, in communities. I think it's 26 different trusts we have students placed in, and that doesn't actually come into consideration all the care homes, community placements that we actually have. So we have a phenomenal problem. And when the students go out into placement, how do you keep track of them? How do you find out what's actually happening? How do you know how they're actually progressing? And what currently happens is we've had link teams. So we have a link team of nurses which is attached, of lecturers which is attached to each trust and each placement area. And they go out and support the students and the mentors in practice while they're there. The problem being that in September we split into 2 faculties, so we've lost half our lecturers. So now we can't actually sustain the ability to actually keep those mentor teams actually going because we don't have enough lecturers. And so I've got an email, as all my colleagues have actually got, saying, well, we're going to change the model of how we support these students in practice. What we're going to do is each tutor has got to individually visit, is sounding familiar to any of you? Has got to visit each of their students in practice in their placement areas. And just my heart actually sank, because we've been here before. This is where we started from. So how am I actually going to visit all my students in practice? And I had a conversation with Anne Devlin, who's our Deputy Dean, and I said, Anne, I know what you're trying to do because we want to improve our students' engagement in practice. We want to make their experience, and they're actually complaining that they feel a bit isolated when they go into practice. And so you're saying to me that what you want me to do is go out and visit them once in a long placement. So I'm going to visit them once every 6 months. Apart from that being very expensive, us visiting all the students, how's that going to improve their engagement? How can I improve student engagement just visiting them once a month? I said, you need to use My Progress. Now, Anne Devlin, she's actually convinced. She actually knows that this is a really good solution. But what we have to do is actually prove that it works. And I really truthfully believe that it would improve the student engagement in practice, that we'll be able to communicate with them much better. And I'll explain how it will do that as we go along. So, starting small. My Progress trial. So we're starting really small with a trial of paediatric student nurses in Essex. I have to confess, we did have a trial that started earlier this year in September, and we had some teething trouble. And actually, I've learned from that myself as well, in that we had problems with things not working as we actually quite wanted them to. And if I'd actually started earlier and had a thought and identified these problems, I don't think it would have been an issue. But we stopped the trial really quickly. And I think that was actually the right thing to do, because stopping it stopped us actually losing the goodwill that we were actually having. And I think we can absolutely rectify that problem, and it won't happen again, because I've actually learned from that. So what we're going to do is the competencies are actually going to be on tablets. And I will show you this, what it looks like. And I've got some of these that you can have a play with at lunchtime if you want to have a look at how it actually looks. And so what My Progress does the students can take the competencies out to practice with them on a tablet device. Currently, they go out with paper documentation, so each year has a different paper document. The problem with the paper documentation is that if you can imagine that huge region, I've got no idea how the students are actually progressing while they're in practice. Until they actually come back in, I don't know how they're actually getting on in their placement area. We do hear, if students are failing, we have a very robust system of being informed about failing students. But what about mediocre students? How we can support mediocre students before they fail to stop them failing? What about students who are actually really good? I want to know that students are doing really well to actually praise them, because that will actually make them feel much more positive. I want to be able to engage with them. So what my progress actually will allow us to do is to see instantly how students are actually progressing in practice. It doesn't actually require the internet to work in practice, which of course anybody who knows anything about the NHS, except apart from Basildon Hospital, which actually has free Wi-Fi for everybody, I think, which is amazing, yes. Once you go into practice, you can't use the Wi-Fi, you can't use the Wi-Fi network. And also we have places in Suffolk, there is nothing, in the Fens there is nothing. And Papworth Hospital, anybody know anything about Papworth Hospital? It is a black hole. Prince Philip was a patient there recently, well, a couple of years ago at Christmas, got admitted. And actually there's all kinds of press members at Papworth Hospital, and they couldn't get, there's nothing, there's no Wi-Fi access, there's no internet access, and they couldn't actually get anything, they were distraught. So we have that problem, but this is brilliant because it doesn't actually need that. So what happens is the students record it on their tablet when they're actually in practice, and then when they come back into the college, or when they're in a Wi-Fi area, it syncs. I don't know if any of you know iTunes, so it syncs like iTunes does. And what we're doing is we're actually giving them the tablets because we want them to play with them. So if they're actually playing with them, then they're actually more likely to switch them on. Once they switch them on, it syncs, so they upload the information. And myself as a tutor, I can actually see how my students are actually progressing in practice and provide them feedback and support. So that's absolutely amazing, really. And the other thing that's actually incredibly useful is it runs on the company's server. Now, I don't know if your IT departments are anything like ours. If I had to get this, I'm sorry if anybody from IT department is here, if I had to get, somebody who knows, Sharon knows, if I had to get something running on our IT servers, Anglia Ruskin University, I would still be here in probably a decade because it wouldn't be up their priority. So nothing would actually happen. And if you think this is actually easier, it's easy. I've already had complaints from IT saying you can't actually do that, and you can't actually run something without our permission. I just emailed Anne Devlin and Alan Turner and said IT aren't happy, I'm carrying on anyway. And they've actually, so anyway. So you have to develop broad pairs of shoulders and just carry on with what you're actually doing. And my colleagues in the faculty can actually see it. And actually, I don't know that there is much that they can do to stop me. So, because it's not running on their servers. And likewise, when I go into hospitals, one of the other questions you might ask me is, what about the trusts and taking the tablets into trusts? Is this, yeah, you're all nodding at me, is this going to be a problem? If you think about it, what's going on in trusts at the moment? Addenbrooke's Hospital, which is one of our biggest trusts in the area, is currently started the e-hospital. So they've actually got digital recording and digital record keeping, which they started 2 weeks ago for the entire hospital. Now, there were always people who will actually complain. I was just looking at the newspaper, and it made me smile, because there was one consultant who was clearly unhappy at Addenbrooke's this week, and he said one patient's record didn't actually turn up on the actual surgeon's list for the operation. This is actually putting the patient at risk. And I sat and I thought, well, actually, how many notes go missing? How many times do the paper notes not actually turn up for your patients? And I think, do you know what, you're just making this to suit your actual purpose. The interesting thing about this is when I go to the hospitals and trusts and I speak to the governance offices and I speak to the IT people who actually know, And usually it's because somebody, some nurse or somebody in the clinical placement says, we've got this maverick at Anglia Ruskin University who wants to give student nurses tablets, and they're going to bring tablets into the hospital. She can't do that because it's risk. I'm thinking, okay, I'll speak to the clinical governance. When I speak to the clinical governance and I say, it's not running on your network, it's not putting any patient data on it, it's all about student data, they say, oh, we don't care, it's much better than paper, it's much more secure, we're not really interested, fill in our form, that's absolutely fine. But from people who don't understand, you have to be very supportive and give them a little bit of education. So I'll get comments from like nurses in practice, like, we've got nowhere to store these tablets. So I'd say, well, where do you store your handbags? You know, where do you store your purses? Have you got a cupboard in the sister's office? There's got to be a way around this. The other thing we'll actually get is, because we're doing it with paediatric nurses, is that there's cameras on your tablets. You can't actually take cameras into patient areas with children. What if they start photographing children? And I say, well, do you know what? If somebody, they are professional nurses, they're going to be professional nurses guided by the NMC. They know with their code of conduct they shouldn't actually be doing that. If they really want to go and take photographs of children, they don't need one of our tablets to do it. They can put their iPhone in their pocket and actually do it. So you get all manner of people coming with things at you. Okay, so what is the benefits of this? So the benefits are that it's going to enhance the ability of our tutors to manage the student progress while in placement. On an individual, but you can see it in entire groups, and don't worry, I am going to show you the exciting bit. I am going to show you what it actually looks like. So we can identify when students are failing early and take early intervention to support them. The other thing that we can actually do is increase lecture engagement with students in placement. So communicating with them all the time. So much more than that, I'm just going to visit my student once every 6 months in practice, which is not going to make them any happier on the NSS. It really is not. And I don't think anybody in the university is deluded that it will, but they're looking for a solution. One of the things I'd actually say is you have to find, if you want to convince people to do something, you have to find what their lion is. And what I mean by their lion is what can you do to make them see that they really need to do this? I was a donor transplant coordinator for a time, and Christian Bernard, who did the first heart transplant, he said, would I have a heart transplant? Probably not. But let me ask you something. If you have a crocodile-infested lake, would I jump into that crocodile-infested lake? No, but if there's a lion chasing me, then I'm actually going to do it. So you need to actually find out what is motivating the people that have the money and the finances. And of course, if we're in a university sector, the NSS motivates everybody, doesn't it? The National Student Score motivates everybody. So what I'm trying to do is speak the language of the NSS in saying, well, actually you're saying our problem with this is with students' engagement, organisation, management. We can impact on that by using NSS, and that actually, by using My Progress, and that actually puts people's ears up and gets you heard. Yes, so I'm hoping that it will improve their satisfaction in practice for what is actually excellent to actually make it even better. The other thing is, students would never falsify documentation, would they? Yeah, we've seen it all. Students will actually fraudulently sign their placement documents. Anybody had that? I'm sure you would. So one of the questions I get asked, well, how are you going to prevent that using My Progress? Well, what My Progress actually does is it allows you to have an electronic signature. So what happens is when the mentor signs the student off, they put in the student's email address, sorry, their email address. And we've asked them all to use their work email address. Two things here. The Tutor, on their view, can actually see who's verified it. If it isn't an email address that is actually from a professional organisation, you know it's a false email address. It is also, we ask the students to tell us who their mentor is at the beginning, so it should match who their mentor is, so we know that it is actually an accurate one. If they try and actually use the mentor's email address without them knowing, the mentor gets an email to say that they've actually signed the student off. So the mentor knows if their email address has actually been used. So in fact, I think it will actually reduce falsification of documentation, because I can't think how you can get around it, really. Students are clever than me, and I'm sure they'll think of something, but I personally, and I'm not that stupid, but I can't actually think of anything. The other thing that you have to think about is cost, because cost is a big thing. Our practice documents cost £20 per year to actually print. So that's £60 across the 3 years that we're actually sending out in practice documents. These tablets that we're using, £160. But then when you actually start off, well, we could put the module guides on there. We could stop, actually, I say, remove all the printers and stop any photocopying of any lectures. And we could automatically save loads of money. And of course, students are increasingly now having their own tablets. So I think they will get to a point where we won't actually need to give them in any case, because they will all have them. Or what we'll have to do is just have a small amount for the students that actually don't have their own. And my progress will run on any... So I'm doing marketing for the company here, so not under their pay, really. But it will run on any platform. So it will run on Android platforms, it will run on iPhones, Apples, whatever you want it to run on, it will actually run on that. The other thing that we've got to look after is our mentors in practice. So allow us to actually facilitate and communicate with our mentors when they're in the students. And Anglia Ruskin is huge. We are well known for actually our ecological profile, and we have an institute of, I forgot what it's actually called. Yeah, sustainability. We have sustainability. So actually talking that language in our university works really well as well. So we're really into sustainability, and we've been recognised nationally for our sustainability efforts and won awards for it. And actually all that paper is not actually very friendly, and I think this actually is much more friendly. So lots and lots of potential benefits. Challenges. This has not been easy. So if any of you are actually thinking, it's all right for her, it's not. It's actually not been easy. And anybody who's actually seen me through this journey at the university knows that I've been plugging away at this now for about 18 months. I was acting director of teaching and learning last year, and I got the company down to speak to our senior management team, who loved it, didn't they? They were very receptive. Our dean was incredibly receptive, said, do it now. So he said, write me a proposal. So I wrote the proposal. And he said, no, it's not the proposal I want. Write the proposal again. So I wrote it again, and again, and again. And I got to a point where I was actually correcting the errors that he'd actually made in it, and he'd already corrected. And I wasn't actually getting anywhere. And I thought, I actually need to find a different source of money. And I was in a meeting with the lovely Sharon Waller here, who said, we're underspent by £24,000 on our learning, teaching and assessment project. And she said, we need to spend it, otherwise we lose the money. Anybody got any teaching projects that they would like to do? And I'd already got my proposal, and I said, yes, how much of it can I have? Can I have all 24,000? Not so much. So I managed to get £6,000. Sharon thinks I'm a cash. She thinks I'm a cash. She's a cash cow. I do. Yes. So I mean, the interesting thing about that is that was £24,000 of money within Anglia Ruskin University that had been allocated that year for teaching and learning projects that people hadn't applied for with good projects. So there was money within the university to do things, but people weren't applying for it. And well, they may have been applying, but the quality of the projects wasn't actually good. So I managed to get that £6,000. I thought, well, I need more money. And Anglia Ruskin University, we have learning and teaching fellowships, which comes with, I think it's £4,000, £5,000. So what I need to do now is I need to be a learning and teaching fellow, not because I particularly want to be a learning and teaching fellow, but I want the £5,000. I do want to be a learning and teaching fellow. So I said, well, I want that £5,000. So I wrote my proposal to be a Learning and Teaching Fellow, and I got my Learning and Teaching Fellow, and I got the £5,000. That's another £5,000. And then we had the project for this year, and I thought, oh, I need to do another project to get some more money out of them for next year. And so we wrote another project proposal with George, who's my colleague up there, who's fast becoming my best friend, actually. And we put another, and so we got yet another award from Anglia Learning and Teaching. So I do love Anglia Learning and Teaching, actually. They've been incredibly supportive of this project. So I found my own money. And I've had people, in the university saying, well, how come Sian's actually running this? And I said, well, because if I wasn't running it, nobody else would be. And I think one of the things you have to take is if you want to change something, you have to take responsibility for it yourself. I've actually discovered it's no good me actually saying this is a really good idea. Can we actually run with it? Because what I've actually realised, unless I'm actually kind of there like a little ferret nibbling away at it, nobody else is going to do it. I think people think it's a good idea. They're very accepting of it. They can actually see how beneficial it is. But everybody else is busy with their own agenda and what they've actually got. So this has actually become really my project and George's project now as well. So you have to take responsibility and make the decision, I am going to do this, and I'm going to find a way of doing this. And I'm not going to give up at the first hurdle, because there will be hurdles, and you will have actual problems with people, with funding issues. And there's gatekeepers as well. So, for example, this is going into practice. So one of the important people that I had to get on with is our director of professional practice, who actually has a responsibility for making sure our practice is all right. Because the NMC looks at what's going on in practice, and we can be shut down. All our courses can be shut down if it's not right. So I had to get her on board. And she's a digital phobe. She really hates technology. So it was really, really hard work. But what actually got her in the end is once I'd got the documentation that she was familiar with, our Anglia Ruskin documentation, onto the tablets, and she could see how it actually worked, a light bulb actually went on, and she actually suddenly became another one of my friends, and she really can actually see how it's beneficial. The other thing that I actually have is we have the trust. You can't just go to a trust. They've got I kind of look in awe. There's a university in America that did 1,000 students in one fell swoop. I don't know what it's like in America, but it's not like that here. And they didn't do any mentor training. I mean, that just doesn't work where we are. We have big gatekeepers. So I went to the senior management, so the Education Liaison Managers meeting in Essex, and said I wanted to actually trial this in practice. And there was a couple of people who were a little bit, we're not sure about that. But I got the permission of the Elms in practice. And what I've actually found is when I mention it to people in practice, when I mention it, they actually go, ooh, panic, panic, panic. But when I take them the tablets and I actually show them what I'm actually talking about, their attitude completely changes because they can see. So, and then I've got my lecturer friends at the university. I've got to convince them as well. And our lecturers here, I don't know what it's like at university, we are short-staffed. We actually don't have as many lecturers as we like. And so I've tried to make it as easy as we possibly can for the lecturers. And I have to confess, the company have been very helpful in that they digitised practically the entire document for me. So our first document, Tom actually did the digital version for me, and there's a couple of other things that I actually did at the end, so I've figured out how to actually work it and do my own documents because I did a couple more myself. But it's not that difficult. So they've made it as easy as possibly can. So, and for the next lot, I've actually personally booked to go and see all the mentors who are going to be using this in practice to try and support the colleagues who are from our child branch, who actually are very short-staffed and don't have enough in the team, but are very, very willing to help me and have been very supportive. Oops. So, are you itching to see what it looks like? So this is the platform. So this is us how we've actually set it up. So I'm first of all going to show you, this is the tutor view. So this is what I see as a tutor. So as a tutor, all I actually need is my computer, my laptop, what I've actually got normally, and you just log in to a web address. So I'm just logged on to a web page which is on my progress. And so this is actually the cohort that we started to trial. And so I can go in as a tutor, and I can go to see view cohort overview, and I can instantly see my students. The reason it says no new responses is because I've actually been in and had a look at the responses that the students have actually had. So I'll just click you in. I've got permission of one student to show you. So if I can go into any of the students. So I could now see how she's actually getting on in practice. And one of the things that we've actually done, so this is our practice competencies. One of the first things students actually have to do when they go into practice is they have two things. One is they have to confirm their mentor status. And this is actually requirements for all universities that actually have student nurses. The NMC requires us to keep a record of who their mentor is. And what was actually happening is the students went in, it was put on their paper document, and then they had to phone that information to their personal tutor. Guess what? They didn't. So your personal tutor would then spend a day trying to track that information down, or 2 days to get it from their students. But now it goes on the tablet. So I can actually see, so I put this as an assessment, but it's not really an assessment, if that makes sense. So what I instantly know what the data of the placement is, and I can actually see who her mentor actually is. I can see that the date of the last mentor update and the month of the next triennial review. And that helps me as well, because I now know who her mentor is, so I can actually check that it is that mentor that is actually signing off. And I've got her email address there. The other thing is we do have a mentor register, so I can actually check that that is one of our true live mentors. And I know my progress are actually working on a mentor portal. I don't know much about that. I'll let them talk about that if they want to. So that's really helpful. So that's actually will hopefully save a lot of tutor time. The other thing that we actually had is that the students have to undertake an induction within the first week of being in clinical practice. And the NMC actually came to us and said, how do you know that they complete their induction within the first week? And the answer is, actually, we don't, because we have to wait till they come into practice, or we'd have to ring each student individually, or chase the paper to make sure that they've actually got that. But now what I can actually see is I can actually see that they've actually completed that induction within the first week. But I don't just have to actually look at it from the students' views. I can actually look at a cohort. Oh. You can get all sorts of data out of this, but I can actually look at who's actually completed what and the completion rate for each individual assessment. So I can actually see how many of the students have actually completed that particular assessment, and if they're not completed by the first week, then I can actually send them an email to do that. I have an item bank which contains, so these are all the assessments that I actually have for the students. One of the anomalies, actually, I have to put them in reverse order on here to get them in the true order to send them out actually on the students' tablets. The students actually see them in the correct order, but I've got them in reverse order here. So we've got everything on here to, if I go to the last one. So it starts off with their confirmation mentor status, their induction. They've got formal meetings, learning contracts. I don't want to bore you with our documentation, really, because I'm sure you've all got your own. Through to actually cluster skills. I'll just show you one of these. I won't show you everything because you'll all go to sleep on me. So this is the cluster skill. And there are actually some benefits to this, is that, literally the students can click it on their tablets and say what they actually are. and I put links in to documents to actually support, so they can actually find out what the fine grading actually means, which the students can see on their tablets as well. But there have been benefits, because one of the issues that we actually have in practice with these cluster skills is that for first years they're not meant to achieve above a level 2, but some of the mentors will actually give them a level 5, and we keep saying, no, you can't give them level 5, they shouldn't achieve above a level 2 in the first years because they won't be at that, and some of the mentors still don't listen to us, but actually this gives them no option. They can only choose 0, 1 or 2. So there's quite a lot of benefits in that. And you can actually use it as a portfolio as well. So students can upload into a portfolio and put resources there. But also you can actually send other things out to students. So, for example, what we could do is, if there's an interesting article in the press that's come up about paediatrics, some interesting research that they want the students to learn about, we can actually send that out to them via My Progress and actually say, have you seen this, have you read this, you might be interested. So we can continually send them bits of information. The other thing, I'll just go to, the other thing that I can actually do, can you see I can email the students? So what I can do is I can look at the students' assessment, so I can look at what they've actually sent to me, have a look at how they're actually getting on in practice, and send them some feedback from my desk. So I can actually say, well done, Jane, it looks like you're doing really well in your placement area, or I can actually see my students who are struggling and actually think, actually maybe I need to contact that student. Jane, I noticed that you're having a little bit of problem with X, Y, or Z, can we chat? Do you actually want me to come and meet with you? And now, instead of me spending 3 hours visiting one student in a clinical placement once every 12 weeks, I can engage with my entire cohort in 3 hours, sitting at my desk, sending them information direct to their placement on their tablets. And so I can only think that that is what's going to increase the engagement and improve the experience of the students. So yes, so there's assessment response report, so I can actually see which assessments have been completed, how many students have actually done it, who's actually not completed, so I can chase up students who haven't completed things on time, and generally find out actually what's going on with them. And I'm sure, would you like to see the student view? The students can we decided against apples because they're so expensive, really, and we are on a limited budget. And because I've only got as much money as Anglia Learning and Teaching I could wheedle out of them. So I am actually on a budget, and as much as anybody actually keeps coming to say to me, actually you should have done X, Y, and Z, I have to, we have to cut our cloth according to our means, really. And actually I think these are perfectly good means, and I'm not convinced with. So this is our so this is the tablet. So can you see I've got a little My Progress icon? So, so imagine the students actually in practice with their mentor. What they just need to do is click on the icon. Now I can actually see is it a bit fuzzy? Going to turn the lights off. Okay, thank you, George. Okay. So what the mentor will do when they actually want to complete it is they just tap on the assessments, and they then just tap on the first assessment that they actually want to do. And to write on it, see this little pencil here? I just tap on the pencil, and then I can actually start writing whatever I actually want, and providing feedback. What I'd actually say to you as well, what we did is we used our paper. I didn't change our paper documentation at all. If you can imagine, with the nursing course, it's actually validated by the NMC, and I can't change that documentation. And also, our documentation is evaluated as being outstanding by the NMC for practice, so why would I want to change it? So what we did is we literally converted our current paper documentation into the digital format. And actually, do you know what? It's a lot of cutting and pasting, and it's not that difficult to do. In any case, my progress will help me with the first one. And to actually send it, what they do is then they click on the little paper plane at the top. Go back to the dashboard. And literally, they can just go through that. What we've also done is, the other thing that I've actually done is I put some, it all says assessment, so everything is uploaded as assessment even if it's not. So what I've actually done is I have put some information for mentors to start with, so which was actually at the beginning of our practice document. So for example, there are issues, you know, I can actually look at, so I can actually find out who my key contacts are and things like that. So there are lots of different resources that they can use. And I have got 7 of these. If you want to have a play and have a look and see what it actually feels like, please do find me at lunchtime, and I can actually show you how it actually works. And as I say, what I've actually found is I do get phobia from nurses, the mentors. The students loved it, because actually, do you know what? Well, these students on the 18th of December are going to get a free tablet. It's like Christmas, isn't it? It's a really nice Christmas present. The students love it. And in fact, once I actually sit down with the mentors in practice, they love it too. But they're scared and they're frightened, because change is always scary and frightening. So I've discovered you just have to look after people. And I just want to just finish this talk. Just let me go back onto this. See if I can express it. Can I really change? That's me at the beginning of the year. Can I really change? Well, you can change anything. You know, first of all, you have to find out what your lion is. You have to find out what it is that you can get people to understand the language. What is it that's actually driving people? You know, as I was actually saying, is it the NSS results that's actually driving people? Is it, when I was in practice, actually the patient experience that's actually driving you? My line for actually moving weight was the fact that my mother has type 2 diabetes, my father had type 2 diabetes, and my sister who's 18 months older than me actually developed type 2 diabetes. If you want to use something like My Progress, there's no good actually going back to your university and saying, actually, to somebody, you need to do this. And when I actually started this, I was literally just an ordinary lecturer, really. You have to actually take ownership of it, decide that it's actually something that you want to do, not actually give up. You will actually have days where you think, I can't actually do this, and you're knocked back and things don't actually go right. And the other thing to think is, you know, I'm inspired by that university in America that actually did 1,000 students in one go. But I can't do 1,000 students in one go. I can actually only do a trial of 30. But what I do know is that we had a small trial where we actually used Turnitin, grade mark, within our faculty, and we started with 1 cohort. Then we actually, the next semester, we started with, we then actually went on and did 6 cohorts. Within the next year, we did the entire faculty, and now the entire university is using Turnitin grade mark. I can't lose all this weight in one go, but I can lose £1 a week. If you don't feel daunted, start with a small step, and you can succeed in whatever you're doing.